Hi, this video is the art of hair transplant restoration surgery before going surgery, and we're going to do the pre-surgery video, and then if the audience continue follow him, we're going to do a year follow-up. And since he lived pretty much local to where I am, most likely we'll be able to do a year follow-up. And by then, maybe I can convince him to show the full face. But until then, I want to show the audience that hair transplant, especially hairline, is a lot more complicated, and it's an art form. And so you don't just take the hair in the back and slap in the front and pray that will grow. The old day, most of the surgeons, they do the hairline really high up and leave the forehead big. And the idea was you should be happy that you have hair. They did not pay attention to a lot of the aesthetic part. I mean, there's a good reason why though. Number one, surgery in the old day, the growth rate is not high, so you might not have enough for the back to cover it. It's only what if you lose all your hair? Well, you don't want to go too low where it eats up more graft and take more graft to cover it if you lose more hair. So you rather do it high, and that way you don't need to cover that much, and at least give you some coverage. But nowadays, with the advent of the technology of hair transplant, the growth rate is very high, and so even you lose most of your hair in front all the way to the back, we still have enough to give you pretty decent coverage. So that's why we not just focus on having hair, but having hair that's natural for you, and it's the art form. And that's what separates me from a lot of surgeons in the clinic, is I focus heavily on the artistry of the hairline. On average, from the mid-eyebrow to the hairline, it's around 7.5 to 8.5 centimeter for Caucasian, and Asian and black around 6.5 to 7. If you look at this client, from the mid-eyebrow to the hairline, it's exactly 7.5. And same thing, roughly around there, you see. And then we did the midpoint here, and from the midpoint toward the side, it should be 8.5 to 9 centimeter, and this client is almost 9 centimeter, and then there's a point here. And so we do the measurement. We want to make sure that's proportional, because you don't want to bring in one farther in and the other one out. So this client, the farthest is 9, his is almost 9. So we want to be conservative with him. And then this is 7.5 centimeter. And the line is just an imaginary median line. It's the midpoint, but really we dance up and down. And then there's two type of hairline. You have called the tight hairline and then soft hairline. And so the tight hairline has a smaller zigzag. The soft hairline has a bigger zigzag. Now, what's the difference? The smaller zigzag, tighter hairline, it bring more of a wow factor. It draw people's attention to the hairline, but it's still going to look natural. So quite a bit of celebrity wants that type of hairline because they want to bring a wow factor to their hairline, and they give more an impression of more density. Though you should use the same amount of hair, but versus the soft hairline, the zigzag is bigger. That means it looks more natural and looks soft. The hairline looks softer than this tight hairline. But the downside is that when it looks softer, we use a lot more root to grow single hair. That means it doesn't look as dense, although they are the same type of hair. So it's something for an audience to think about. Or you can go somewhere in between, and that we can minor part, and we can design the surgery day. So once I get the shape down for this client, if you can turn this way, you see we brought in the temple quite a bit. His is like more than a thumb, and through the years you slowly gone backward. If for his type of hairline, he now bring down. If I don't bring it in, it looks he will have a really wide forehead. It won't look natural, and so you look on this side as well. There we go. Look down. And so we're gonna try to fill in as much as the front here, and whatever left, we fill in the crown area. We attempt around 4,000 grafts or more, if whatever hair I can get out from him, and give him the best result. And that way, I want to do one surgery, and so we don't have to come back to do multiple surgery. So this is the art of hair transplant. Once we transplant, once we get the shape down, we start transplant 35, 45 in the front. Increase when you go backward, change it when you go different direction. Then select, not only the precise angle is important, selection of hair graft important. Transplant rows and rows, single hair graft in the front, followed by root of 2 hair, 3 hair, 4 in the back for bulk and volume. Thank you.